intelligence, which, as you know, is the most trendy innovation aspect or vertical in GI and healthcare in general, we're finding ways, and I'm going to almost lump artificial intelligence and precision medicine together because I think there is overlap there. So we are trying to find how can we implement AI in every facet of our clinical practice. Okay. So the roadmap could be the patient experience. So a patient walks into my office. Before they get to my office, I want AI involved in helping triage when and where the patient should be seen. I want AI involved in talking to the patient's insurance company before we're involved to determine where, if the patient needs a procedure, where can they get done. I want AI to already tell me when I'm walking to the patient's room which medications are going to be preferred. And why that's important, even before I see the patient, is all that leads to extra work that takes away from patient care. Okay. Not just extra work just for me, but for the staff of the office and all the time we spend not focusing on the clinical aspect of the patient is time where we are taking away from what our original goal is, right? Our goal should be to have a consult with our patient and provide a clinical outcome or clinical treatment plan. What takes away from that? Well, the payer is saying, okay, well, these are the 4 tiered medications we choose. Or they're saying, you can't have this endoscopy here, you can have it there. I want to know all that before I get in with the patient. I don't want to waste time afterwards and then delay the patient's care. Okay, so that's back office. I want artificial intelligence in the consult room with me. Okay, the biggest example of this are the scribes we see, right? The AI scribes. We see this. We've tried a few different ones. We have preferences. Some work with our EMR, some don't. You want that scribe right there. Okay. When the patient leaves the visit, that AI scribe will already generate a summary. Why is this important? So I'm not one who brings a laptop into the patient room. Okay. A lot of my partners have no choice. Documentation is a big part of what we do. And if they don't bring the computer into the room, they won't be able to document fully the visit. AI can do that for us, right? AI can interpret the visit, document it, and have it ready to go. So we are focusing fully on that 30 minutes to the patient, fully. When the patient leaves your office, AI again has a role. That AI, like we said earlier, the back office end, can help us triage where the patient's next step is. We don't need to have a prior authorization team call and determine what we are going to be allowed to do, because that's a reality, right? I can have my clinical decision making, and then I got to figure out what I'm actually allowed to do. Can I get a CAT scan? Do I need an ultrasound first? Can I do an endoscopy? Can I order this medication? Do I need to fail these 4 medications? That all that delays patient care. Forget my burnout, my extra effort, my staff's extra effort. It delays patient care. And in 2025, I believe we have the artificial intelligence tools already available to completely streamline that to provide a better patient product. And then in gastroenterology, where else is AI involved? Well, next level, they come to our endoscopy center, right? We've seen this already with CADI, computer-aided detection of polyps, computer-aided diagnosis of polyps, already exists. But wait till we get into the upper GI space. Wait till we get into the pancreas, the liver. A lot of what GI is image recognition, right? And artificial intelligence and large language models already exist to make it much easier for image recognition.